let's go ahead and call the open session to order. But before we begin the meeting, I want to announce the board will be adjourning today's meeting in memory of Greg Tarter, a longtime colleague and respected nurse for the organization. I did not have the privilege to know Greg personally, but Greg has been described as more than a coworker. He was a source of kindness and support, steady strength. He was known for his compassion for others, his dedication to Tahoe Forest, and the warmth he brought to every interaction. He made a lasting impact on everyone who had the privilege of knowing him. One of those individuals is fellow board member Alice Wong, and I want to just invite her to share some words about Greg.
Thank you. Thank you, Michael. Today, we pause to remember Greg Tarter, a nurse in the intensive care unit whose presence meant so much to his patients and to all of us who had the privilege of knowing him. Greg was a landscape architect prior to entering nursing. When asked why he changed careers, his comment was, "Well, trees and plants can carry on a conversation." In 1998, he relocated to Truckee and started working in the ICU at Tahoe Forest. Greg brought with him more than a conversation. He brought kindness, compassion, and a genuine sense of caring that patients felt. He had a way of connecting with others that made even the hardest day a little lighter. Working in the ICU requires critical care expertise, calmness under pressure, and deep compassion for patients and families facing some of life's most stressful moments. Greg embodied those qualities every day. He also had a wonderful sense of humor. Greg would make us smile, if not laugh, when we needed it most. Many of us remember how he would break into song at the drop of a hat. Music was clearly something that he loved, and he shared it as part of the joy with others. If his singing wasn't enough to make you smile, then he would offer you a piece of gum he would pull out of his pocket. Seems that back pocket held an endless store of pieces of gum. In a place where the work can be intense and emotional, Greg had a special way of reminding us how much kindness, humor, and small moments of joy matter. He passed away was sudden and deeply felt by all of who knew him. When we grieve the loss, we also celebrate the spirit he brought to our team and the care he gave so generously to his patients. For many of us, Greg Tarter will be remembered as the face of the ICU. On behalf of the Tahoe Forest Hospital District Board of Directors, I want to express our deep gratitude for Greg's service and a heartfelt condolence to Ellen, Julia, his family, friends, and colleagues. His compassion and his spirit will remain a lasting part of our health system. Rest in peace, Greg.
Thank you, Alice. Please join us in a moment of silence in memory of Greg. All right, thank you. Always hard to move on from that, but the agenda calls us to do so. So, David, if you wouldn't mind, a report of actions in closed session?
Sure. The board considered 4 items in closed session. The first was the minutes. Those were approved on a 5-0 vote. Second was a liability claim of a Mr. Cisneros against Tahoe Forest. The board voted to reject the claim related to breach of contract. Third, trade secrets, there is no reportable action. And the fourth item medical staff credentialing, those recommended credentialing decisions were approved on a 5-0 vote. That concludes my report.
Thank you, sir. Do you have any deletions or corrections to the posted open session agenda? No? Any from the audience? No? Item 10, audience input. I mean, it's an opportunity for anyone from the community, the public, to share items not on the agenda.
Is Zoom able to be accessed by people?
Yes.
And
Zoom will be,
Is there a waiting room for Zoom,
Yes,
and there's nobody in it?
that is correct.
Oh, thank you. I asked because Janet Van Gelder says that she's in the waiting room.
You can't get in.
A very virtual waiting room.
Is she on the closed session?
I was going to say, there's a closed and an open
It
Zoom.
might be she's at the
I will email her.
All right. While we're working on that, any input from employee associations? Hearing and seeing none. Item 12, President and CEO monthly highlights. Anna.
I do not have a clicker. I do not have a clicker, but I will, if someone can run the slides for me. Thank you so much, Chair and members of the board. Thank you for the acknowledgement of the life and service of Greg Tarter. Really very much a big loss felt across our system. I do want to start, if someone can advance the slide. I wanted to start with an announcement, and that is that. So I wanted to announce, I think that many know this already, but I will announce it again here because I don't think it's been announced at a board meeting, that Dylan Crosby has assumed the role as Chief of Clinic Operations. This is, again, really, I just really want to acknowledge and thank Dylan for stepping into this role in addition to his already existing swath of duties that he is in charge of. But Dylan will be working in close coordination with Dr. Evans and the leadership across the clinics, the dyads that are in existence across the clinics, and really be working with a sharp focus on access. So again, I just want to thank Dylan and make sure everyone knows that's who to go to. If you have some ideas, he's actually very interested in those ideas. And on that note, I will just say he has also, as part of his duties, he was leading a system redesign team, and those efforts have been resulting in, he has already conducted a mapping sessions of both pediatrics as well as primary care. These are really important because these are kind of go through every step of the experience of getting an appointment, kind of how appointments are made, how many appointments are available. Those really are now leading to a dashboard, that what we're calling the real-time access dashboard. That's not a public dashboard, but it's important for the public to know because this is, we're kind of tracking this at a whole sort of a much deeper level now, and availability and access. And those data that are being pulled into that dashboard have been now fed into a predictive model. We already have the pediatric predictive modeling. It has already been occurring for 2 months. It's about 2 months now, so it's really moved beyond sort of the wash period into where they're really now starting to pull from that predictive model and design tests up against that predictive model. And primary care also, that predictive model is already complete as well. It's been in existence for about 30 days. So now kind of moving from like all the data, let's see, trying to move forward here.
Can you give us an example of predictive modeling?
Dylan, are you in this room? Yeah, it's really, and really we're modeling, I just want to say, I'll give you my Anna Roth high-level thing is we're modeling the amount of time we predict to have available and the amount of demand we predict. And then sort of being able to design and staff up against that, but Dylan can give you a much more comprehensive answer to that. And I just want to say my clicker's not working.
Yeah, it's a great question, Dr. Brown, or Director Brown. Our, Doctor. So our goal was to map third next available for all the visit types. The visit type is kind of our norm. And in doing so, we did 3 years of history, except for primary care. We actually went before COVID. So our goal was to track and trend all the visit types as well as our distinct patients. So we're trying to get a baseline of how big is the community, how many people individually are using our services, and then exactly all the different visit types being generated as our baseline model. It is not going to be perfect. It's going to be an iterative process, but we had to have that foundational understanding and have logical estimates of what the future looked like to test our change against. So foundationally, what we can do is we have a model, we're building out a model for what we expect in the future, and then now we can do tests of change and truly measure all those areas of impact and how it impacts each distinct patient and each distinct visit type. Does that answer that question?
Yeah, how does that coordinate with the physician need assessment? I mean, is that part, are you finding that, and it's probably too early to know, that the physician need assessment is realistic in terms of what the predictive modeling is?
So we can use our existing templates and essentially how much patient-facing hour time we have against our predictive model of patients and see what the delta. So you're exactly right. It's a great forecasting tool for us as we look for a workforce development strategy and as we forecast growth in the future. We'll align both of those, and actually in our model we have a full supply side of the curve and a whole demand side of the curve that we line up against. Yeah. Yeah. More to come at the end of the fiscal year as we touch on our goals and set new ones for next year. Yeah.
And if you could move the slide forward, Devin. And just very quickly, I think we covered most of this. But I will just say we're going to be moving again from a department level strategy to also community informed design. So I do want to say one of the things I'm really excited about is we did work with an improvement advisor over the summer to work on wellness and joy in work. I don't recall what we ended up calling that team, but it was under Dr. Kreis and Dylan's leadership. They brought in an improvement advisor. Well, that advisor is coming back, and they will be working with community focus groups on April 13th and 14th. These are members of the community that have been invited and are currently even being invited. So check your email inbox, public. You might have an invitation to come be in one of our community focus groups. We're going to have about 24 to 36 people come in from the community and also sort of validate this modeling and inform the tests that we're going to be putting together. So there will be 8 groups across 2 days, 4 to 6 people in each group, so we can get much more of the qualitative data and really what it is to experience our system from the community's perspective. And then there's a whole series of design of questions that have been designed that are really have been really designed to spark kind of interactive conversation in each one of these 90-minute meetings. So we'll bring you back that will be in addition to the 5,000 voices. But this is really around making sure that we are designing tests with not only our providers but also members of the community. I do want to just touch really quickly on one other thing about Health Within Reach, and that is, you heard Dylan reference workforce strategy, but part of workforce strategy also is workforce housing. And I just wanted to kind of provide a quick update to say, and Ted is not here, but Ted and Dylan have both been consistent members on the workforce housing task force and actually coalition, the JPA that we have with the region. And we just wanted to say that since its inception, that we actually have had over 300 employees benefit from this service. And that ranges from like housing concierge, sort of linking you to a rental program, some down payment assistance, home buyer readiness education, and kind of everything in between. So, as you know, it continues to be a really big challenge here at the top of the Sierras to get people to work every day, and or even more challenging to get them to actually live in this community. So, really appreciate the work there.
For clarification, that's 300 Tahoe Forest employees? or-
300 Tahoe Forest
Holy
people.
cow.
I wanted to just really quickly talk a little bit about transformation. And you'll see that tonight we're doing kind of just two sections, health within reach and transformation, two sections of our True North, because we just had a big update on the 5,000 voices, and which is really focusing on the Peaks of Excellence last board meeting. So tonight we just wanted to give you just a quick update. Just to let you know, again, I think we've talked a lot about, and it doesn't matter what aspect of your life, AI is becoming a really big deal. And it's, even though the pace it's moving across all the other parts of our life, I just want to say it's moving that fast, if not faster, in healthcare. Sometimes if you go to a conference or if you kind of open any kind of trade, publication, it's overwhelming. The just sea of AI enabled kind of products that are happening. I want to acknowledge the leadership of Dr. Gladman and Kyle Cattell for leading our clinical IT governance committee, and really that has really led to a lot of, I think, I anticipate quantum jumps within our system. They have decided on a AI-enabled sort of documentation, sort of ambient documentation system, and that will be, you'll hear more about that in the upcoming year. There is a lot of formal governance going on. There's the clinical IT governance. Now there's going to be an AI governance. So there's a lot of work going on around this. It might seem like nice to have, but this is must-have kind of structural oversight. And I just want to acknowledge that it takes a lot of work. And for those people who are leading that effort, and really I do also want to just call out Dr. Evans for this. He's very closely involved and has been really the driving force of getting people. He's like the chief recruiter of these committees. But it really takes a lot of thought, and also it takes a lot of time from those team members to get up to speed, because again, there's just so much happening. And they are really developing a lot of muscle in this area. So we have a cadre of people who are really helping to lead us forward in a very complicated environment. But I think the other thing is that these kinds of tools will be really, really important as we think about access going forward and expanding our model of care to be able to really bring in and use some of the new tools that are coming into the market and are very, at this point, they are proven tools. So I think, again, very grateful to that group. I know we had sort of we had a one-off meeting, we had a one-off discussion last meeting about executive rounding. Dr. Evans continues to tell everybody that I'm sort of leading the charge, but we all know that actually Dr. Evans is actually pummeling all of the executives. He's everywhere all the time. But we are doing executive rounding. It's kind of happening over an 8-week cycle. And so over 8 weeks, and I just want to acknowledge Kelsey. I don't know if Kelsey's here tonight, but Kelsey has been put together the schedule. It's like herding cats for her, but over 8 weeks, all of the executives should visit all of the sites. And I do want to say, unless there's a really big snowstorm and Anna Roth is on the other side of, and I'm supposed to do Reno that week I will just admit I didn't make my rounds in Reno because it was a very big storm, as you all know. But we're actually we're getting out there, and I think we've hit all sites. I'm looking to you, Dr. Evans, but yeah, we've hit all sites. And what's really been fun about this is that people are starting to expect us, and they're ready for us, and they have stuff to tell us, good stuff and some challenges. So, more to come on that, but just wanted to give you an update on that. I also wanted to just say a couple of things about leadership recruitment. We talked about Dylan earlier and that he's moved into a new and expanded role. But I also wanted to say that we were introduced to Natasha Lukasvich. And she, again, I just want to say she's the Director of Operations at Incline Village Community Hospital. Lauren Zafaro, who had joined as our Director of Home Health and Hospice, we're very happy to welcome her. She joined us from her most recent system, which was on the other side of the lake. And then Lauren Lassard, who has moved in as our Director of Community Health. I think she's on like her 17th day or something, but it's been really fun to welcome them. Next week, we will be meeting with our final candidates for the Chief Human Resource Officer position, and so we hope to come back with some updates soon. We can go to the next slide. I wanted to recognize a couple of people. We had 3 Incline Village Community Hospital nurses nominated for Northern Nevada Nurses Achievement Awards. One was nominated for Lifetime Achievement was Ellen Bjorkman. For clinical leadership, Molly Cocking. And for emergency nursing, Elizabeth Cook. Congratulations to them. Cybersecurity, I'll actually just say, I just have this up here just to say, for people that might be worried or people might be wondering, yes, we are seeing a big uptick across the industry, across the nation, across the world with attempted cybersecurity breaches and cyber attacks. It is, I'll just sort of generally say it's thought to be related to the sort of geopolitical landscape and war. So our IT team has been actually really focused on securing our systems, and so this is a very deliberate effort, and this is not specific towards Tahoe Forest. This is actually happening globally, but very specifically in health systems across the country. So just wanted to make sure people know we are aware of it. We're on it. Nevada Rural Health Transformation, just to say that grant funding has been allocated to support healthcare systems. Our Chief Operating Officer, Louis Ward, has been very active in the design of this, kind of advocating the distribution plan of this. And again, this is really going to be around infrastructure, system innovation, and some transportation in the state of Nevada. And so we're going to see, these are pretty big dollars, but again, the definition of rural health system is pretty broad. And the kinds of the buckets of the money are really infrastructure. So, things like supporting telehealth, perhaps, things like there will be some in each state, in both California and Nevada, there is some dollars for distressed hospitals. Thankfully, we won't be applying for any of that. But again, I think it's just to recognize that the rural hospitals have a really big role to play. And though this is a lot of money, it's about a third of the cuts that we experienced in healthcare. So it sounds like a really big pot of dollars, but first of all, it's sort of one-time money, but I mean, for the next 5 years. And some of it has to be spent this year, that, it's over the next 5 years. And it's being spread very thin, and it really doesn't come close to the amount of cuts that systems are absorbing. So I just want to say with some caution, don't expect a big windfall of money, but we're definitely very aggressively going to, try to go after any dollars that support Tahoe Forest and the efforts that we're doing that our community really deserves. So
Is that going to be on a need basis? Or,
Some of it is. I mean, the distressed hospitals, it'll definitely be a need basis. There will be a whole application process, and we did apply for some. I think, is Louis in here? Okay. Oh, there's Louis. Yeah. Do you want to? Yeah. So and it's a good question. I think a lot of people are thinking about this. And again, I want to say we're really grateful for the money, and it won't feel like a lot at the local level. say anything about this?
Yeah, good afternoon, Board. So yeah, Anna summed it up very well. The program continues to keep evolving both in California and in Nevada. But it is an application process. That application process for at least a portion of the money in Nevada is open now, and we'll be submitting our application before April 30th. We actually just looked at a number of potential ideas today that the team put together, all great ideas, no doubt. But we'll kind of narrow down our approach, and we definitely intend on applying and feel good about it.
And then finally, just very quickly, just to say, I just want to remind you, we're doing a lot of work around the climate action plan. And we heard about garbage recently and what a big deal it is and how much garbage we generate, how much waste, landfill waste we generate as hospitals. Not Tahoe Forest specifically, but all hospitals. And again, we have lots of work going on already in the system. We also had an in-house lunch and learn and recruited more than 25 staff to join our climate action work. We'll be coming back with it when we bring you the True North plan. It will have a climate action plan embedded in it. And I'm going to be moving to the board retreat recap. But before I do that, because I didn't have a place in here, and this happened before, after we submitted our slides, and I just want to say there is copies available for the public on the table. But I just wanted to point out to everyone on Monday, we were notified that we did in fact achieve Geriatric Emergency Department accreditation, the JEDA. Here it is. Just making sure everybody knows, and there's 30 copies on the table. But, again, I just want to say, I just want to acknowledge and thank the emergency department staff for taking the lead on this. This isn't just for Tahoe Forest Hospital, it's also for Incline Village Community Hospital, so it's across the system. So we're really excited to have that recognition, and I think it really does kind of launch us into kind of now the next phase. And I know, this is really in pursuit of an age-friendly health system. I wanted to just, and I'm going to end with just a quick board retreat recap, and that is that I just wanted to say we did meet with the board, and we did bring in some external expertise to talk a little bit about the changing health environment. So again, I think we know that we just talked about the increasing financial pressures, operational pressures. We know that, I think there's a couple of things that have come out, and again, this is a little bit of a spoiler alert from the 5,000 Voices, but what we kind of are experiencing even here, this is a national trends that are up on the slides here, but I do want to say, add to that, locally here, Tahoe Forest and Tahoe Forest Health System have been in the transition from kind of a local, small, rural hospital, critical access hospital. I've even heard sometimes Dale, Chandler, one of our board members, described it at some point. Some people used to sort of think it was like a first aid station or something, a stopover place. Well, that is not what we are now. We are rapidly, and I think really with the integration of the medical staff, and really with the growth that we've seen, both sort of starting in the pandemic and post-pandemic, really we are much closer. We're looking much more like a comprehensive community health system, and that is an increasing pressure because we weren't actually designed to be that. Mm-hmm. And so I think there's just, I just want to bring the pressure right here. There's a pressure point right here where I think when we looked at the 5,000 Voices and we talked about that at the last meeting, that dissatisfaction that we saw, which was 43% of the surveys came back with some dissatisfaction, it was really not around the care they get here, but around the care they can't get here. Mm-hmm. They can't get in. I mean, so, again, I think these are our own pressures, special pressures for Tahoe Forest that are even in addition to these national sort of pressures that we're seeing. So I think it's just important to say that this healthcare environment and even this environment here in this health district is really, it's really kind of increasing a lot of pressure across the system. We can go to the next slide again, because I'm not going to read you all of these. I know you have these slides available to you, but we talked about the external environment. We also then talked about best practices, and again, for the public to know, this was just we really went over kind of the best practices for effective governance and the importance of board structure and the importance of meetings like this, public meetings, and again, really pushing ourselves to kind of move as much as we can out into the open session so the public can participate with us. And so that was a component of the retreat. And then if we go to the next slide, we then went over kind of those fiduciary responsibilities. These are I think the structures that kind of demand of us, specific kind of stewardship and guardians of, the public resources, dollars, public trust, and really the mandate to really be accountable. So I just wanted to put those up there on the next slide. The recap again, we just really wanted to give the board, and I just want to thank the board for showing up kind of prepared and really interested in everything that we were talking about that day. We talked a lot about the external environment. We talked about the movement in the local region. We talked about the different kinds of challenges. And then, I just want to report out and thank and express gratitude to the board who really reinforced their commitment to support us in delivering on the public promise of our hospital district, which is a public system. So again, we'll bring back updates to the public about kind of what we're up to in that arena and anything else that you heard today. And I'm happy to answer any questions, the chair or anyone else. Thank you.
Thank you, Anna. Any questions, comments?
No comment. Thank you for that presentation. I think when I read this and you got, my message, what I sent to you was really just, I wanted to kind of understand, it's taken a while to get, since we have a chief of HR and it's been a while, and I think, people are important in this healthcare. The patient is the most important thing. For that clinician and people who do this amazing work are really important. So I want to thank you for taking the time. I think in my impatience, I sat there, it's been a while, but after our discussion and talking, it's important to have the right person in place. So I want to thank you first of having Louis Ward, our CEO, step in and obviously, make sure we can support people here. And from my understanding, it sounds like we'd be a little bit ahead of time if it wasn't a storm that we had recently that may have kept some people away. But despite the weather, which of course is now changing, I'm glad to hear that in the near future, we're looking to have the right person. And if it takes a little bit longer, then it may take longer. So thank you.
Thank you.
From the audience, any input, comments, questions? All right, hearing none. Item 13, Medical Staff Executive Committee. Dr. Koch, welcome.
Welcome. I do see Janet on Zoom here, so something happened that made it work. Thank you, Janet, for being here. The consent agenda today has a lot of policies that are in the desired format, none of which have changes that are substantial, and all of which are pre-existing policies. So there are no new policies to discuss today. And then there are procedures. Then there are the policies to discuss, and there are several policies. The only policy with any significant changes is the QAPI policy, the quality assurance and performance improvement. That's why I wanted to make sure that Janet was on the phone for this meeting, just in case you had questions. There were a number of changes that were intended to just align with the hospital's current goals or also to update to more appropriate verbiage. And so if you have read through this and have specific questions, I'm happy to try to address them, and Janet is here as well to help.
Comments, questions?
I had a comment, I mean, on the, again, on the coffee, in the performance improvement initiatives, the priorities that were identified. I appreciated the fact that emphasis on health equity has been moved up in terms of the list of priorities. So thank you.
Alice, did you have something? I saw you.
Oop.
She's on mute.
We can't hear you.
No, I don't really have a question. It's just that I can't see Dr. Koch. I just have initials all over like Esrich and TTM.
The camera's off?
Looks like our camera's off.
Yeah.
It must be. Where's Janet? Janet's not in the conference room?
No, she's on.
No, I'm
Zoom
here
also.
on Zoom. I just wanted to comment that and I'll lower my hand. The Board Quality Committee, which includes Director Wong and Director Dr. Sarkevich, reviewed this at length at our meeting, and so they provided some great input on the priorities for 2026, which are then here presented to you. This was reviewed by Med Staff Quality as well as MEC, and we are presenting it this evening for approval.
Thank you, Janet. And so we are still not on camera in the room here.
There you are.
Oh.
TT Media feeds it live through
Okay.
Channel 8 TV and through the YouTube channel.
Okay.
So we're live, the Zoom is projected live through
So I'm not sure why the people on the Zoom meeting can't see us, but that's all right.
So it's a different feed, yeah, so it says ESCA
Yeah.
conference room, so that camera up there is not
So
on,
let's change the Zoom view to this viewer.
there.
Now we can see it.
You?
Yay!
There you go.
Wonderful, please, yeah.
Yeah, I think I just want to echo again, in quality, we were able to go over this in detail. I think, for the board, I know it's a big document, but, I think the nice things, the quick wins are obviously, in Part B priorities identified include, and guess what B is? Achieve bronze level geriatric emergency department accreditation. So it lists out really a nice way, and I think also the responsibilities of the board and, the responsibility of each department. Obviously, we're going to be looking at these services and obviously ensure monitoring, sustaining these corrective improvement actions. So we're very excited to continue this in the quality group, and I'm just appreciative of Board Member Wong's leadership there, and it's been joy really looking at these and bringing them to the board for any discussion. So I have no further comment.
Thank you, and to me, all the changes seem reasonable. Dale, any comments?
Nope.
Nope. All right, we'll go to the audience for any comments or questions on these items. Not a single policy question?
Everybody's.
All right.
Motion to approve.
Is that where we're okay? And just for everyone's benefit, one, when I say we, I'm going to point to those that are doing the work to really streamline this process, highlight the relevant changes that are made. We have some 4,000 policies, and so we review these on a regular basis. They're reviewed in detail in committee and then are brought to the board with a recommendation for approval. So that's why there's less conversation than you might think on the length and number of these policies. But yes, with that, we'd be looking for a
Chairman
motion.
McGarry?
Yep.
The one thing that I did notice that, I don't know if it's a problem because of our updates on our computer, but I noticed that a lot of the policies no longer have previous dates, last approved dates. It all has NA on it. And so I don't know why that has happened. So how do we know when the next one is due?
So on my copy, there is last approved and next review
Okay, for quality assessment,
for all of the policies that are in that format for you.
okay, because I guess it's all the ones that are sent out to us, because we'll have more policies that don't have dates originated, dates approved.
Are you referring to the Excel spreadsheet of the chart, or are you referring to the policy stat format?
The individual policies. So if you looked at the quality assessment performance improvement plan, there's no original date.
When they go through in draft form before they reach, so the owner will make the changes to them, the owner of the policy will make the changes to them. They're reviewed in the department level and MEC, and then they're in pending format, and the dates are blanked out until the department director or the chief approves them after this meeting. And then the dates are reinserted by policy stat.
Oh, so the original date in the
Yeah.
past oh, okay.
So after the board approves them and the final approver puts their approved at the board meeting stamp of approval on it, the dates will go back in.
Thank you, Sarah.
Thank you for the clarification. All right, looking for a motion to approve.
I would move approval.
I'll second.
Motion and a second. Sarah, if you wouldn't mind a roll call vote?
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you, everyone. And thank you, Dr. Coe. All right. Item 14 on the agenda, consent calendar. These are items expected to be routine and non-controversial. They'll be accepted upon the board, or acted upon by the board without discussion. However, any board member or staff or others can pull an item should it warrant discussion. So do we have any items to be pulled from the consent calendar?
I wanted to pull item 14.3.1. I had dinner with Jake Dorsey. He said he was prepared to answer it, but I don't see Jake. Is he outside?
Well, if we do pull it, it'll go
It'll go
down
at the end,
to
yeah.
item 17, so we hopefully would have time to
Yeah.
find Jake.
So you would like to pull?
14.3.1.
Okay, the board reports, all
Yeah.
right. Any others? Okay.
No.
So with that, we would then look for a motion to approve the consent calendar with the exception of 4.3.1.
Any public comment?
Thank you. Any public comment? Okay. With no public comment, we'd be looking for a motion to approve, noting that the 14.3.1 has been pulled.
I will so move.
I'll second.
Motion and a second.
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you. All right, item 15, sports medicine presentation, recognizing Athletic Training Month.
Aha,
Welcome, everyone.
yeah.
It's all point, okay.
Yeah, you can come up here. It's okay. Dr. Coe sits here all the time.
Okay. You can read my script if you would like to. I'm just
No, but
kidding.
I do want to put a vote in for most beautiful presentation.
Oh, thanks.
You've had a chance to look at the pictures there. Gorgeous.
Well, you'll soon see. Hi, my name is Anna Aldridge, and I am the manager of sports medicine and also one of the athletic trainers. So the next slide would be great. Thank you. So I want to first start with what our goal is as sports medicine and our outreach program. And our goal is to provide high quality care and while building trust and fast tracking these athletes in. Essentially what we're trying to do is we're trying to bring that service to the community rather than always having them come to us. And that's just so that we can make healthcare easier. And one of the reasons and how we do this is through our athletic trainers who provide on-site care while also fast-tracking those athletes in with the help of our sports medicine clinic team. Let's go ahead. Thank you. So I think what is really important to answer is what is an athletic trainer? And I think it's easy to get caught up in what it says. Athletic trainer, a lot of the things we hear, and our ATCs here will probably laugh and nod along with what I say is, oh, so you train athletes to be strong? And my personal favorite is, you're just a glorified water girl. And although those things might be accurate, they don't really show what the scope of an athletic trainer is. Athletic trainers are board-certified healthcare professionals. They go through a rigorous education and are now required to have a master's now. So that includes injury prevention, emergency care, clinical diagnosis and rehabilitation, essentially the full spectrum of care within the healthcare setting of a traditional athletic training realm. And one of the unique things about being an athletic trainer is they're oftentimes the first point of contact for those athletes. And not just those athletes, but the families as well. And when they're there pretty much every day, whether they like it or not, for games, events, practice coverage, anything like that, they build this persistent and consistent relationship with these athletes, their families, their coaches, and not only that, but with the sports medicine team. And since we have a coach, well, two coaches here, that one of them surprised me sitting over there, my husband. I'm going to call that one out. So it's just really shows you that all of these athletic trainers, they really get to know each of the individual on a very deep level. It's not just about their injury, it's really about their overall mental and emotional well-being, while also just caring about them as individuals. And one of the coolest things that we know in this community is that ATCs are one of the most trusted athletic trainers in these settings that they work in. And an example of that is TTUSD does this Caring Connections survey, and the ATCs are oftentimes named one of the most trusted staff members in those settings. And then in addition to that, the ATCs do work under the supervision of a physician, our current medical director, Dr. Rizak, and then Dr. Winans back in the back who came out of retirement to be here. But the ATCs essentially work as that bridge between the athletes and their families and the broader healthcare system. And I want to also mention that this ongoing support between the staff that they work with helps create that trust and partnership between everyone. Okay, so this is a gorgeous picture that shows that our program started with Dr. Winans. And I think it's really important to point that out. So in 2003, Dr. Winans started with an injury prevention program at North Tahoe High School. I believe it was with the basketball team. And then the following year, she used her own money to purchase concussion baseline tests for the Truckee High School athletes. And then from 2004 to 2017, she continued to advocate for this injury prevention programs with our high schools, and that's North Tahoe, Truckee, and Incline, and helped advocate for part-time ATCs, which were very, very part-time, but were still at those schools, and they were contracted through the PT department. And then all of her hard work finally started to pay off in 2018 when Tahoe Forest hired their first full-time ATC, which was me at the time. And then in 2019, we added a second full-time ATC who's at North Tahoe. And then even amongst the pandemic, we were able to bring on 2 more full-time ATCs. One was at Incline High School, and then the other one was split between Sugar Bowl Academy and Palisades. And because that athletic trainer, who I'll introduce you to in a little bit, was so great, Palisades asked to increase those services, which then led to us adding a 5th full-time ATC at Sugar Bowl Academy the following year. Yeah, exciting. And so what this slide really shows is that our community peak at Tahoe Forest is essential, right? And our outreach programs within sports medicine really shows that we are trying to strive for that community. And this is, our athletic trainers are here tonight, and I will have them each stand up when I talk about your primary location. So I'll start at the bottom right, and that is Truckee High School, and that's Jennifer Hornback. North Tahoe High School is Molly Sitter. Incline High School, Tamanay Tolentino. Palisades Ski Team, which is McKaylee. She was also the individual who was splitting her time between Palisades and Sugar Bowl, and Palisades stole her away completely. But then it gave us the opportunity to bring in Karen Rossman at Sugar Bowl Academy. And there is Woodward on here because we do provide summer services for Woodward for their summer camps, and that service is covered jointly by Tamanay and Molly. Okay, next slide. Thank you. So this slide really shows the collective impact of our athletic trainers. They're not just at each of those locations, but they actually they do other job duties. And it's important to note that injury reduction testing and programming, while also the baseline and post-injury concussion testing. This is showing that we're not just being reactive, but we're being proactive. We're being proactive. We're identifying risks, proactive is a great word. We're identifying risks before the injury happens so that we can keep them healthy from the very beginning. And then moving into our programs like BFIT. And I want to point out that they see over 800 elementary school kids right now. That is 42 classes and 5 schools. This is led in most by Jen, and with the help of Molly, McKaylee, and Tamanay going into each of these schools. And then we also have a physical therapist, Craig, who helps with that too. But what they do is every month for 8 months, they go into each of these classes and they teach an injury reduction exercise once a month. And then their teachers will help progress that exercise throughout the month. And the idea is, research shows that if we can get into elementary schools to help them learn biomechanics and proper exercise, it actually reduces the risk of ACL tear later in life. And what's really cool about this is it's so popular that there's a wait list to be in it. And also the middle schoolers also want to start being involved too, but we just don't have the staff to continue to grow that at this moment in time. And then the next one, concussion navigation, and this is in its infancy right now. We've only been doing this for about a year, and it's led by Tamanay with the help of Molly. They're making phone calls to all our local patients who are seen in the ED or urgent care with a concussion to make sure that they have that follow-up call, because I don't know if you've had a concussion, but if you have, you may not exactly remember what someone tells you at that moment in time. So they're calling these patients, making sure their answers they're getting the answers they need, and they're getting a well-rounded and quality care so that they're not falling through the cracks, which tends to happen in some cases. So really this shows that our community education is about guidance and long-term wellness. They're not just stepping in for emergencies, but they're constantly in contact with patients over time, helping them understand their health and helping educate them to make the best decision for themselves. Not mentioned on this slide is a program that we're currently working on with building a partnership with High Fives Foundation, and that's being helped develop by Karen as well. But really, ultimately, you can see from the numbers here that we're reaching over 800 elementary students. We're seeing thousands of student athletes that are being supported, and a significant number of injuries are being cared for. This is yearly, by the way, by our athletic trainers. And last but not least, I want to mention our sports physicals, because we recently started providing mass testing for these in our community, and we have several physicians here who helped and watched the chaos of these mass testing events. And last year alone, we were able to provide over 200 sports physicals. So it's really just exciting to see this, because behind every number is a relationship. And I think that an example of that is when an athletic trainer works with like their patient or their athlete, they are there from the beginning to the end of that recovery process. They're there doing the initial diagnosis, they're providing the treatment, and then they're helping with that return to play. So what this is doing is it's building a network of trust and relationship between all of them, as well as with the coaches, the staff at the school, and our sports medicine team too. Over time, these relationships and these touch points, they become a reliable and long-term partners with these athletes. So you'll see all of these slides with all of our pictures, and I'll take a moment to talk a little bit more before we're at the conclusion. But really, you'll see here, like, the common scene is athletic trainers taping or walking in like athletes off on the sideline, really just supporting them with their health and safety and evaluating them through their injuries. Rehab and physical therapy are really the biggest times when they create that strong connection, because those, and I'm sure they would tell you this too, those athletes will be in their office for hours at a time. And day in, day out, weekly, monthly, maybe even years. But what the athletic trainers are doing, they're fulfilling the high schooler's whole career in the setting of their sports, and whether it's club or a school sport. And they become their motivators, they become their mentors, they become their educators along the way. And while reinforcing that their health is their priority, and not just how well they do in their sport, whether it's in competition or participating. I also want to continue to thank the sports medicine clinic team, because without them, we would not be able to have such an efficient process. The ATCs communicate with our staff within the clinic. The physicians are there every step of the way to help communicate back and forth to make sure that nobody falls through the cracks, and all of these athletic trainers get the help that they need. And then lastly, for going along with that, but I do actually want to point out, if you would go back a few slides, one more maybe one more. Sorry, this is a slide I think is really important, because it shows that one of our athletic trainers is carrying around her baby.
Yeah, I see that. That's
and
great.
that's Jen. I'll just make sure she's pointed out.
Yeah.
And I think that just shows that it's really kind of a family. So our ATCs create a family with the relationships that they build with the athletes that they're working with. And again, like you can see through these pictures, that overall, these relationships extend far beyond just one single season or injury. They're following those students through good times and bad times, all of their successes and all of their challenges, and they're part of that, part of that process, and helping teach these athletes that you are more than your sport. You are more than just what you're doing. And the impact is lasting. These students remember the athletic trainers. They always remember who was there, who showed up, and who helped them through not just their sport, but teaching them life lessons to give them a well-rounded life and well-being. Okay, now I'm at the conclusion. So really overall, our goal is to just continue to provide that best care, that high quality care to these outreach community partners, but also to grow. We have a lot of locations and clubs that would like to add these services, but not just clubs, but in people like concussions who just want to know if they like their baseline concussion and then how they're doing after a concussion. So there's just really, the opportunities are endless, essentially. And that's all I have. Any questions, or for our ATCs as well?
Yes, I've got a question, if I may. I'm a 20-year instructor at Palisades Tahoe. And one of my pet peeves is you're dealing with youth. I'm a senior certified instructor. And one of my concerns is in the last 12 years, I've lost 5 friends who've died on the hill at Squaw Valley because of age-inappropriate thinking they're still 40 when they're 70. And it troubles me greatly. And in fact, to the point where I went to Casey Jowers, who puts on those specific case studies, and told him I wanted to do a case study for the ski patrol. And of course, his immediate response was, "You're finance, you're not medical, what are you talking about?" And I said, "Yes, I know, and this is the reason why." And so he and I put together a presentation. He talked about the physiology of aging, and I talked about spreading the word for older guys to make age-appropriate decisions about where and how they ski.
Yeah.
And I haven't skied the West Face in 2 years. I'm done with it. I'm 80 years old now. I've had enough of it. I got out the old risk-reward balance scale. So I'm not sure how you can interact with that, but if you do see an opportunity, I hope you think about it, spreading that word.
Absolutely. I don't think that we want to limit ourselves to just these youth athletes by any means. Dr. Rizek and I on Tuesday actually went and presented to lacrosse coaches. So we're definitely willing and very much hopeful that we can provide education to anybody who's interested.
Yep.
We just need that avenue.
Yep.
Yeah.
Okay.
So thank you.
Yep.
I have a question. You mentioned earlier that you do the concussion screening as well as the concussion follow-up on patients, and I wasn't sure if that was student patients or is that the general population?
So right now, that is only our student population. We use 2 different apps. One it's called Sway Medical, and all of the student athletes at 2TUSD, Palisades, and Sugar Bowl are baseline tested before their season. And then when they receive a concussion, we have an objective screening tool to see where they were at in comparison to their baseline. Washoe County School District uses a different system, and that's because they're in Nevada and they have their own laws and regulations, but it still is a baseline screening tool. One of our goals, though, is to offer this concussion tool, like as a baseline screening tool to anybody in the public. And then they will have that opportunity to, if they feel like they got a concussion, which if they hit their head and they have symptoms, it is a concussion. But we can then objectively test them as part of their return to activity. That's again, it's very briefly we've talked about it, but that would be one of the ways we would like to help the community.
Well, I'd also like to add my thanks. I have 6 grandchildren, and they've greatly benefited from your service.
Unfortunately, fortunately.
Yeah, they sing nothing but your praises. And I can't emphasize enough the importance of a trusted adult. aside from the services that you provide and all of that, but, you just keep hearing about the importance of a trusted adult in the lives of these young people, and thank you for all that you do.
Thank you.
Please.
Just a few comments, if I can amplify. So thank you. I didn't quite catch, right, you said you were persistent and present. There was a great quote you had in there. If you remember, that's okay. That's okay. It was really good. And it was like persistent and present, which I loved, and I'm going to take that one, but I loved it. But three things that I just kind of wanted to repeat, because this really hit me, was one is the sports physicals. I think, parents often get their well child visit in the summer, overload the clinics because they know they got the physical. Sports physicals aren't reimbursed. So often they have to be included into the well child visit to give that. So I want to thank the physicians who gave those sports physicals. When I did my telemedicine visit, we thought about it, we ended up not doing a telemedicine sports visit because it's not the right thing to do. But what happens, families who don't have access, that's their one chance for their kid to enter the sport. If they can't get that physical, they can't play that game. And they can't play that sport, that can change the trajectory. So thank you for improving access to care for our community. Two, I think about a year ago, I'm trying to remember, we were at TTUSD. We met TTUSD a while ago, leadership, to talk about our partnership and how things work. And obviously, you guys came up as such a great experience. The two things that I was really proud as a new board member was, one thing that was access to care. It was a very interesting comment which I picked up was, they help our injured students and their parents navigate the healthcare system. Nothing is more scary than your child gets hurt and then you have to figure out how to get in. And it was just really lovely to hear that. And then I echo you, Mary, exactly, that trusted adult. Adverse child experiences, ACEs, huge discussion of how, many certain things can really adversely alter a child's health for the negative. And the number one antidote, the number one resilience is a trusted adult. So I think you give a lot more than you can give numbers for, but thank you for being there. Thank you all.
All right, thank you. As a board member, I thank you. As a parent who raised two kids here, I thank you. As a coach at Palisades, I thank you. Your presence is felt. I did have some questions, or I was maybe looking for some comments or observations around access and equity, because that's, when I looked across the playing fields, they're not level, right? Some kids have more access than others. How do you feel, beyond the navigation you're talking about, Rob? Do you feel you're sort of on the front lines with some of these families, some of these kids, that you might be their caregiver?
100%. And I'm sure, I don't want to speak for all of you, but yes, I would agree. I don't know how many times I would sit in, let's say it's an ACL tear. That's like a season-ending injury. And it's heartbreaking when that happens. And you're there with those kids right when it happens, oftentimes right when it happens, and you're helping them through that entire process. A lot of these ATCs also attend the appointments with the kids, and if they're able to. And part of that is helping just navigate those questions, because sometimes parents or guardians don't really know what questions to ask. Mm-hmm. And so the ATC being there to help navigate that and help provide that extra level of what about this question, so that the parent or guardian really fully understands. And then outside of that, then continuing that conversation with the student and just continuing to show them, like, again, this isn't the end. Like, yes, you probably are not going to be able to play the rest of this season. However, let's look towards the future. Mm-hmm. But again, this sport isn't your priority. Your health and well-being, your mental, emotional, and physical, that's more important at this moment in time. I don't know if any of you would add anything to that, but I would imagine you feel like you're on the front lines.
Yeah, I will say for my
Just for the viewing audience.
Yeah. Okay. Again, I'm Jen. I'm the athletic trainer at Truckee High School, but I will say our foundation within our sports medicine outreach through sports medicine and ortho collectively is absolutely huge. So, for example, Truckee High School football, we went to Hawaii as our first game of the season this past fall. We had a significant ankle dislocation, resulted in transport to the hospital, and everything is, island time in Hawaii. Our student athlete and his parent were about 6 hours into the ER, hadn't had his dislocation reduced yet. So the communication and the care that we've already established prior to this, I was able to contact Anna directly. We're able to get Dr. Dodd on the phone. He kind of reviewed the case, reviewed the imaging. The doctors in Hawaii were pushing for immediate surgery. We're like, you're going to have to stay in Hawaii. That's extra cost out of the parent's pocket. He's not going to be able to fly home right after surgery. So then we collectively agreed as a group. Ankle was stabilized. We already had an appointment set up and established right when he landed. Pre-op was done that day. Surgery was scheduled for like 4 days later. So things like that happen all the time. I think our physicians and our surgeons try to move relatively quickly to support our student athletes and our families. And that's just something through the sports medicine outreach program and our athletic trainers that we kind of try to establish like that priority, that care, just so it instills trust in us as individuals and then in our hospital system.
Great story.
Thank you.
Oh, I was like, where'd she go? There she is. Alice, do you have any comments, questions?
My only comment was to address the fact that so many of our, at least in Truckee, a lot of our members of sports are underserved individuals. And to be able to have that relationship with the sports trainers and how that enables the child to help the parent navigate the health system is, you can't put a price on it because they have the confidence. Their parents figure, well, they're students, they know, and will help the parent enter into the health system when needed. So thank you for some of the sidebar kinds of rewards we get from having the trainers in the school system.
All right, thank you. Any other? Well, I'll get to audience. Just checking real quick. Any other? Input from the audience.
To tag on to what Alice said, your services are immeasurably valuable. I'm wondering if you have found any ways creatively to start to try to measure your impact.
Good question.
Yes. Specifically for the hospital side, we measure the amount of referrals that we send in. So the athletic trainers, we're doing it quarterly now, but they'll go through all of the referrals that they sent in, and then ultimately we measure the downstream revenue that comes from that. So that way we can at least have some understanding of what we're doing with the hospital. Recently, we also just sent out a survey to TTUSD. That's the coaches, the administrators, and staff at the school, but also the students, and that's non-students and athletics, the athletes as well, and then also parents and guardians. So 3 separate surveys. We don't have the responses from them yet, but ultimately our goal was just to see how much or how safe do you feel with the athletic trainer there? Do you feel safer when the athletic trainer is there? And do you even know your athletic trainer? We do, service primarily the athletes in these locations, but a lot of times the students that are not participating in a sport will still come to the athletic trainer with questions. And it's not even limited to just the students. I'm sure Jen and the other ATCs know, I've spoken to a lot of coaches. I work with multiple people in administration. They always go to the ATC to talk about their injuries, which, that's great. And we'll oftentimes even get parents, the weekend warrior parents, who are like, hey, I did this to my back the other day. So they're always there for those patients as well. So we're trying to get that information with those surveys that we sent out. But if you have ideas of another way we could ask for their input, all ears.
Matter of fact,
This is Dr. Koch again. I mean, have you measured injury rates? Is that too non-specific to measure? And have you measured, recovery and return to sports, things like that?
That's a great question, and we are moving in that direction. Because of the wide variety of injuries, it's hard to really navigate all of them. Our surgical cases, we follow the same protocols that the surgeons provide the PTs, and we can tell you if they're on track or not on track. Concussions are very well monitored through our sports med team as well as the athletic trainers in the return to play, but we haven't done specific measuring of those outcomes yet, but that is on our list of what we would like to research and further understand. Absolutely. And I know Dr. Rizek agrees.
Hi, my name is Ace Pena. I'm on the wrestling team, and I've been wrestling since I was little, and it's something I've always taken seriously. This past season, I became the first freshman from our school this year to place at a state tournament, and that meant a lot to me. But I didn't get there on my own. I had a lot of support along the way, and one of the biggest people behind the support was Jen, our athletic trainer at Truckee High School. She does so much more than people realize. She's always there for us no matter how busy she is, and she really cares about every single athlete. I personally had to rely on her a lot when I had a concussion. She helped me throughout it the whole time, even though I was trying to get back in before she let me. But she helped take care of that and made sure I was okay and ready to get back into my tournaments. And also, I have cauliflower ear just from blunt trauma and wrestling. She took me out to get it drained herself, and I think it was really helpful that I can trust her and have her bring me places. And she's really special. It's not like what she does, but how she does it. She treats us with respect and care, and she makes sure we're actually healing the right way, so we're not rushing back too soon. She plays a huge role in keeping all of our athletes safe, healthy, and able to compete, and she's a big part of what keeps our teams going strong. Thank you, Jen.
Thank you.
I'm a parent of two boys that did multiple sports at Truckee High, and we also hosted 3 exchange students, and all 3 of them also played sports. My name's Catherine Schnurrenberger. And I just wanted to say that Anna first and then Jen, because my kids went through 2 trainers, were really, really important. And also the support in terms of each one of those exchange students also has to get a sports physical. And that's a whole different way of, now you've got this kid from another country and you got to navigate all that. And really a lot of thanks to, I think Dr. Winan did the sports physical for one of our exchange students. And so thanks to this whole community, the athletic trainers, but then also the Tahoe Forest and the sports physicians for everything. Yeah.
Thank you.
Okay, so Louis Ward, Chief Operating Officer. However, I am coming to you tonight I'm actually also the under-8s Truckee Wolverines football coach. I have 4 kids who are in about every sport you can think of, and I can tell you just as a coach and as a parent, when I see an athletic trainer on the sidelines, it brings me a lot of comfort. So I just want to say thank you as a parent tonight and as a coach, because you guys are doing some amazing work in our community, so thank you.
Good. My husband.
As previously stated, my name is Derek Ince, for the record. I think it goes without saying how important they are. They show up for us every day. That's why we're here. But outside of that, I don't think it's realized how important this program and this outreach is. As a coach, the wrestling coach, or ex-wrestling coach, I guess at this point. But many schools do not have this access. And I think that the reason why you see that North Tahoe and Truckee at the high school level and Incline as well are seeing the success that they have had over the past few years, and then beyond that, is in part because of the care that they receive from the athletic training staff. There are countless times where we go to wrestling tournaments, or there's anecdotes that you hear from other coaches in other sports that they don't have that, and they're jealous. And I think that it cannot be put in words what it means for coaches, for parents, and then also for these kids to stay healthy, reach their goals, and have that community that supports them along the way. So thank you for supporting the outreach program. Obviously, I'm a little biased since I'm the husband, but as a coach, I really do truly mean this. What you guys support with this outreach program is incredible. So thank you.
Thank you.
I'll keep him.
And I heard out of retirement? Is that what I heard? Okay.
Acknowledgement of retirement. So I'm Nina Winans, sports medicine doc, now retired. And I will just say that when I first got here, 30 plus years ago, when I was 12, I got involved with health promotions because community health was one of the big missions that I had in my life. And seeing, full disclosure, when I put down my credit card for those concussion tests, I actually got them reimbursed, within 3 months or so from the CEO at that time. That was the extent of the support. And I did thousands of volunteer hours by myself, but could see when I went to the American Medical Society for Sports Medicine that in most other states they did have athletic trainers, but in California there were no high schools that had certified athletic trainers. There was no funding for it at that time. So I sat down with the administrations, like, if you can give me $500, how much more can you give me to let's build a program here? And to see, this would not have happened if it wasn't for the hospital and the board saying, you know what, yeah, we actually do believe in this. And to see the development of this and what has come from it has been pretty amazing. And I think this is one of our opportunities in our community. We always hear about the access to care and what we can do with reaching underserved populations, their whole families, the soft handoff, the navigation, the relationship building from this whole team. This is something we can really capitalize on in different areas. The BFIT program, I was part of starting that. It stands for BFIT in Tahoe. When we first started it through Health Promotions to go out and do activity bursts in the classrooms in elementary schools, has now turned into an injury prevention program, which is brilliant. And it is the same concept, but we didn't have that structure that is now there because of what Jen and the rest of the team has helped build. And I really think we talk about this all the time, like, how do we stop this injury epidemic, and especially on the girls' sports side with the ACL injuries, they're much higher risk. Maybe this is part of where we have gone wrong in some of our studies. We have started too late. And we see the little foals that the kids turn into. I bet Louis' kids, that are preteens and teens, when they start having those, I kind of cringe at their body mechanics, and it's not really, the biggest surprise is not that they got injured, it's that how did they not get injured before this? So we have opportunities to build more. It's going to take more manpower. So I guess that's, my plea plead with all of you that make these decisions. You saw how successful this is and how the reach into the community. Can we build that further? And I think there's lots of opportunity. But thank you for all your support through the years.
Thank you, Nina. Any other comments? Please. No. It's open mic night, yeah.
My name is Dr. Kari Rizak. I'm the current sports medicine physician and took over her job. Exactly. I certainly echo everything today. There were a few points that I was just listening to. Community outreach. I've sat in other board meetings how we talked about food insecurities being kind of a hot topic currently, like in this year. I know that there's a project that Jen is kind of in the infancy stages of, but she kind of identified there were food insecurities for athletes, so like getting enough nutrition to actually go out and do these things, which can also prevent injuries. So she's actually working with their wellness team, and the wellness team is obviously working with Tahoe Forest, and so it's kind of a big circle there. So even in that aspect, but I've also seen them kind of navigate challenges with undocumented students who do not have insurance and how to get the best care for them, and working with them. So that's been really cool to see them navigate kind of the delicate nature of those issues. And then for future references, obviously there's a lot to grow. One of the opportunities that I think that maybe you had mentioned was like how are we kind of moving things forward and kind of growing, and like how are we monitoring things. We do have like yearly meetings with our principals, and through those yearly meetings we say like what is good, what is bad, what can we grow from. And so one of those opportunities, we're going to be taking those injuries that we have and then coming up with kind of prevention plans, and so that we can be proactive, preactive, and kind of grow things forward again. But again, I echo Dr. Winans. I think the more that we can push into this, again, incredibly biased, but I think it's really great for the community. Thank you guys so much.
Thank you.
Thank you so much.
All right. Again, thank you for all you do. Thank you for being here tonight. Thank you for sharing your stories. This was an item just for board discussion, so no action taken. We do have 3 items under agenda item 16 for board action. We did approve through the consent calendar a number of policies. There were 3, however, that cannot be approved in or under a consent calendar. So item 16.1, disruption of telephonic or internet service during, or of telephonic or internet service during public meeting. Sarah, are you going to lead a discussion on this?
Certainly. This is a new board policy recommended for approval. It's been through the governance committee. It's been reviewed by our general counsel. It's required by the passage of SB 707 with the updates to the Brown Act. If there is disruption to our internet or telephone service during board meetings, it requires the board to take certain actions which are laid out in the policy. With the updates from general counsel and the governance committee, you have those updates here. Is there any questions or discussions about the updates that we?
I just hope we don't have a disruption.
You have to wait an hour. Yeah, 1 hour.
That's a long time.
Yeah, it is.
Yeah, and again, obviously most of the policy is guided by.
Was it on like emergency food or something during that hour? Yeah. No, all joking aside, I've read it. I have no comments except that it seems understandable.
Yeah. And well
Is that something we
reviewed.
need to vote on?
This will be an item for.
It cannot be
approval,
approved
yeah.
by consent. It has to be voted on.
Any other comments or questions from the board?
Alice? Nope, she's not shaking her head. Nope, okay. I'd like to make a motion. No, I'm sorry. Oh, audience.
Any input from the audience? That dwindled
Yeah.
drastically.
What's left of the audience?
Thank you.
With no audience input, we'd be looking for a motion.
I would like to make a motion to approve the policy disruption of telephonic or internet services during public meetings, ABD 2601.
I'll second that motion.
Motion and a second. Sarah, if you wouldn't mind.
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you, everyone. All right, next item, 16.2, community outreach for underserved communities and hospital board meeting engagement. David Ruderman, I have your name next to this one. Is that?
This is, well, mine and David's is
Okay.
next to all three of them. But this is also part of SB 707.
Oh, sorry, that's just the way it laid out on my
Yeah.
document. Okay.
Yeah.
Sorry, didn't mean to scare you.
I mean, I'm happy to comment on it, but I'll let Sarah go. She's prepared this one.
Okay. This SB 707 requires our legislative body, which is the board, to make, adopt a policy to make reasonable efforts to encourage groups that don't traditionally attend board meetings to participate in board meetings. So we drafted this policy. It's been through governance committee. It was revised slightly in governance committee and is now before the board.
And I would just comment that the law does specifically say that you can't sue a legislative body based on their purported failure to take reasonable efforts. So reasonable efforts is entirely within your discretion. This is one of staff's recommendations for how that can take place.
Great, thank you. And just to shed a little light on the conversation we had during governance committee, we spent a lot of time talking about words like may include, because obviously you put forth, best effort, but even with the greatest of intent, we're not going to reach everybody, right? So that the policy was not tried to be completely prescriptive of, all the things that absolutely have to get done, more recommendations of things we may do to encourage participation. But with that, any comments, questions?
I think we see an example of this just tonight on the screen.
Mm-hmm.
And I commend those who have been involved in seeing that this is accomplished.
Yeah, these three policies we're reviewing, generally they're either new policies or the changes in them are related to telemedicine. In governance, we did go through a checklist of all the things that had to get done to make this happen. Sarah, thank you. It was a long list. And Sarah's been leading the charge on that. All right, any audience input on item 16.2? All right, no, so this is again a item for board action, looking for a motion.
I'll move approval.
Second.
Thank you. Motion and a second. Sarah?
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you. Moving on, item 16.3, guideline for business by the Tahoe Forest Hospital District Board of Directors, ABD-12. Again, I think this one primarily the changes. This is something everyone should be relatively familiar with. It kind of guides and governs our overall business. Substantial changes here were really around telemedicine and the changes in meeting.
Teleconferencing.
Teleconferencing, excuse me. And changes in policy procedure to support those necessary changes. So there is a lot of red and green on the document, but again.
Mostly just on teleconferencing, right?
Correct. Not telemedicine. Yeah. Otherwise, no substantial changes to the policy. Any comments, questions? No.
Was there anything in the governance meeting on this one?
No.
Anything overall, just? Then no questions.
Nope. All right.
Yeah, this one basically just updates the policy, given the fact that we're going to have to comply with SB 707 starting in July. So it includes those provisions now.
Excellent. Thank you.
Input from the audience? No? All right.
Yep.
Again, looking for a motion on this item.
I would move to approve the ABD 12 as presented.
I'll second it.
All right, motion and a second. Sarah?
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you, everyone. All right, item 17, we did have one item pulled from the consent calendar, item 14.3.1. Jake, thank you for sticking around.
Yes, yes.
Always do.
Dale, I believe you pulled it, so
Yeah,
we'll let you lead the conversation.
Right. I've got a comment and a question. The comment I wanted to make was, there's many here, I'm sure, who remember Chuck Zipkin, internal medicine doc, wonderful guy. He was on the board after he retired. And whenever Jake would make his report, a highly technical report, Chuck's eyes would roll back and say, I don't understand a word. Do you remember?
He would say, is this in Swahili?
So I just wanted to bring to everyone's attention, your board report it's on the agenda right now, is fabulous.
Thank you.
It's comprehensive, it's understandable, it's informative. I just wanted to compliment you.
I appreciate you.
Even, as Sarah knows, I am the least techie guy in this room, and yet even I could understand it. So thank you for that. The other thing I wanted to say is, and I want to start with a little metaphor. We live in bear country. I live in Tahoe Vista. I'm one of 8 homes on a 6-acre parcel. I am the only home that hasn't had a bear come through the window or door or whatever and create all kinds of havoc.
Yeah.
What's that? I know I'm jinxing myself by saying that.
Do you not have anything good to eat in your house, Dan?
Yeah, well, yeah. But in any event, the point I'm trying to make is, obviously, I've been successful in sending those bears down the road. And to me, there's as I say, this is a metaphor, because we have this AI now that is attacking our system, like those bears. And obviously, we want to send those AI crooks down the road. We do some benchmarking of certain things, our medical quality, our patient satisfaction rates, et cetera, with other hospitals. Do we have any idea how we measure up compared to other hospitals? Are we more vulnerable than the average or less vulnerable than the average?
First of all, my name's Jake Dorst. I'm the Chief Information Officer at Tahoe Forest Hospital System. Thank you for having me. So yes, we do. The plague of AI is getting better at fooling people on clicking things in emails, because it's learning whose relationships to whose bosses are whose, how do people talk, what do you ask for, kind of thing on a normal basis. So we use a product called Know Before, where they have the same AI that the hackers are using, and we send out on our own emails to our staff. Bear bait.
Yeah, bear bait, yeah.
And the folks that do click on it, then we get in touch with them and say, hey, and it flashes a big screen like, oh, you just stepped in it. So we are proactively doing that. Our click rate here on average, and these are the numbers, like there's nothing out there that says, University System Hospital X is the best. And if there was a list like that, I wouldn't want my name on it.
Yeah, right.
Even if it was the best. Because you're going to have people that, I want to go get those guys.
It's just a challenge.
Yeah. Or if I'm on the bottom of the list, they're like, that's where I'm going to go first, because all they care about is making money.
Yeah.
So we consistently hit about 8% click rate. The benchmark for our size organization in healthcare for 1,000 to 5 or 500 to 5,000 users is like 30 or 40% people click.
Oh.
So we have a much more, and we drill it into them constantly. Like, do not click on if you don't know that person. And if it comes from the outside, we have a big banner, like this is an outside email, like be careful
Yeah.
if it's got anything in it. So we also attend, so Greg Mortimer went and got an FBI, so he's an agent now, FBI agent, 00 Mort. He is very connected now with what's called ISAC and some other security groups in California and federally. In fact, that meeting, you remember the meeting we had at the airport? Like Greg put that on because the FBI agent was like, hey, you know, one of your town organizations got hacked a while back and they never called us, returned our calls. And he's like, what's going on with it?
Town of Truckee.
Yeah, well, that wasn't it. But so he was like, could you help me get them involved and have a meeting? So now that's formed into what they call TNT, which is kind of all the local districts and organizations are meeting regularly now, led by Greg. So we are proactively out there learning and staying ahead or trying to stay ahead of the curve. But AI has changed things.
Yeah.
So we're buying AI security to fight
AI crooks.
Robot wars.
Yeah.
So.
Okay. Thank you. I don't know if any of you had any other questions related, but I hope that was helpful.
I've yet to be that 8%.
Yeah.
Yet.
Yeah. Yeah.
Okay. Thank you.
Absolutely. Thank you, Jake. Yeah.
Thank you, Jake.
So we then need to approve that. Well, I am going to look for audience input.
Oh, yeah, we have to.
Alice has her hand raised.
Yep.
She's like, no, she
Oh,
doesn't.
no. That was an accident.
Okay. Thank you. So we look for,
I'll make a motion to approve 14.3.1, which is the consent, what is it? It's the
Executive Board Report.
Executive Board Review.
Board report. Yeah.
Board report.
I'll second.
Who gets it?
Oh, Dale.
Yeah. Motion a second, Sarah, if you wouldn't mind.
Director Brown?
Yes.
Director Chamblin?
Yes.
Director Darzenkovich?
Yes.
Director Wong?
Yes.
Chair McGarry?
Yes.
Motion carries.
Thank you. And item 18, board committee reports. Governance committee did meet. We mainly talked about all the policies that just got approved. So thank you, everyone, for that. Any other committees?
Yes. The Executive Comp Committee met on March 16th. We had 4 items at our agenda. The first one was the President and CEO compensation package, and the committee has been interested in engaging a specialist in executive comp to help us along to make sure that we are using the most relevant metrics and data available. An RFP was put out, I think, to 7 agencies, and we've only heard back from 2. So again, we're waiting to see if we can get that. Otherwise, I think we've got one that we can use. What's interesting to note that FutureSense had not responded, and that was our other specialist that we've used in the past. The second item on our agenda was the fiscal year 2026 President and CEO incentive comp criteria, and our President and CEO Anna Roth gave a progress report, and you heard that we made bronze from Jetta, so that's exciting. She's got that criteria she can check on now. But again, there are some that are still giving a bit of a challenge. There's another quarter left before we'll be looking at the metrics in total. We did discuss or start our discussion on the 2027 incentive comp metrics. And it's going to be something a little bit different than we've had in the past. At least that's what we're thinking. We're trying to look at our 5-year strategic peaks. We're also looking at our true north items and seeing what we can come up with, again, for our criteria using hopefully an executive comp specialist. And we hope to bring that because we need to have two in May for approval so that it can go to finance. And then our third item was the annual evaluation. And we considered looking at the annual evaluation tool that we use and also the date at which time we would provide the evaluation to the CEO. And that was because I was looking at when everybody else gets their evaluation is on their higher date. And it sounds like you gave it to Anna recently, so she got it on her higher date. So thank you for that. But we don't have any recommendations to make any changes to the board. And then lastly, we did our charter review, and we have reviewed it with no recommended changes. We will be meeting again in April to further discuss the incentive comp for 2027. So thank you, and that's the report.
Thank you, Alice. Any other committee reports? No.
19, I have a comment.
You've been waiting.
If I have a minute with everyone's time.
Item 19, closing remarks.
I do.
Closing remarks. Okay.
I want to thank you, Board Member Chamblin. I know. Can you believe it?
For what?
Pulling the executive board report last month
Oh,
and talking about the huddles. You got me curious.
oh,
So I went to one
oh,
this morning.
great.
You want to hear about it?
Yeah.
Do you guys want to hear about it? Take a minute or two. So I went to the radiology. I was invited. I talked to Dr. Evans at our retreat, and we would talk more. And so 10 minutes. We were kind of in the hallway. I want to know that we had record CT scans yesterday. You want to guess what the record is?
I don't know.
It's 43. So Sean, who I imagine did most or all of them, got a standing ovation by our CEO, COO, well, mostly standing because we were in the hallway standing.
You messed it up. You just left it standing ovation.
There's a gurney that wasn't working. Things break down.
Yeah.
But you know what the great thing is? That's no email. I mean, of course, I have to go to the email for everything, but how nice is it that all of a sudden there was problem solving?
Yeah.
We were starting to look at, Louise suggested there was possibly there was funding through emergency equipment or whatever, and how nice is that? When something doesn't work and you have the team there to just basically say, hey, we can fix this.
Yeah.
So that was really nice. And so I think the words, it was magical. It was job changing. It was wonderful. Those aren't my words. Those are the people I talked to. So thank you for bringing it up.
Yeah.
Thank you, I know, CEO and President Roth and Brian Evans, Louis, and thank you so much for inviting me. And I thought the board might want to know. That was really interesting to attend.
Yeah.
All right. And Dr. Evans is very non-competitive about
And
being.
since you mentioned that, I also attended a public, what do we call it?
A listening session.
Listening session.
I'm sorry, what?
At the Tahoe House.
Kidding.
And Kim was there, and Jen Malone, and Will, who was our hired individual who was conducting this search. And we had a brisk number of people come through, and one of them, maybe some of you know, Dave Wilderotter, Dave's Ski Shop, and he was delighted. He was delighted to talk. Wasn't he a character?
Well, you are sort of a character too, so it was kind of a mix of the both. Is this on or off?
Yeah, right.
Red light. I just wanted to say, if I can take a quick moment, having you there
made all the difference. You all know everybody, and so I did put a list of the listening sessions on your dais before we started, and if you have the opportunity to come, it really does make a difference because people walked by and he knew everybody, and so would love to see all of your shining faces at one or the other, or all of them if you choose. Thank you, and Sarah sent him my email.
It leads me to a question that I have, and that is, do I recall you said there was a place that we could go to get updates on the 5,000 voices?
Not yet.
Not yet.
So we are going to bring, so little sneak peek. We are about 78.2% of our way towards our 5,000 goal.
That's great.
Yes, we have now left the library in the dust.
Oh my.
Yeah, so I'm glad to hear that. We will bring a comprehensive report to the board next month about what we have learned through True North and really drilling down into what the actual comments say. The survey data is what we kind of showed you last time, but the comments we're getting are substantive and they're important. And so we want to figure out how we pick out themes on those, but also how we pick out important outliers that give us good information. So.
One last guy, if I forgot the one comment, the one feedback I'd love to help for the one meeting that I went to, so it's not a big one, but it does tie into True North, was when you come with a True North, can you have like a 2-word cheer or something? Because when I left that meeting, several of us were kind of putting this imaginary hand in to start the day, and there was a go team, go something. So if you have a go something, that would be helpful for the next one I attend. Maybe that one. That's the one feedback, but thank you.
Yeah. Thank you.
Wonderful. And with that, thank you, everyone.
Thank you.
The March 26th board meeting now adjourned in memory of Greg Tarter.
Thank you.